What is a pathologist? You'd be forgiven for not knowing the answer or for thinking they're those cool lab doctors that help solve cases on popular TV crime shows. But in reality, pathology is at the heart of medical treatment, patient care, and recovery. Pathologists are the doctors who are the key to diagnosis. They're as essential to your medical team as your family doctor and your surgeon. You could say they're the detectives of your healthcare team. They make it their business to understand and diagnose disease so that you can receive the appropriate care. Although you may never meet your pathologist face-to-face, be assured they form the heart of your care team. Every day, pathologists across Canada analyze hundreds of thousands of patient samples, including body tissue, blood, and other body fluids, and make critical diagnoses. Take Tom, for example. Tom recently noticed an unusual-looking mole on his stomach. With a history of skin cancer in his family, Tom thought it best to get it checked by his family doctor. Tom's family doctor agreed that the mole looked suspicious, so removed it on the spot, sending it off to the pathology lab for a diagnostic opinion. On arrival at the laboratory, Tom's pathologist reviews the tissue and leads a team of technologists to produce the necessary slides for analysis. The next day, Tom's pathologist analyzes the mole under microscope to determine if it's benign or malignant. In Tom's case, his pathologist decides it needs additional molecular studies in order to achieve a final diagnosis. In the meantime, Tom's pathologist gives Tom's family doctor a call to share a preliminary opinion and to obtain any additional information. 2 days later, the additional molecular studies arrive, and Tom's pathologist reviews these and comes to their final opinion. And it's good news for Tom. The pathologist concludes the mole is benign and issues a diagnostic report. The family doctor gives Tom the good news. However, what would have happened if Tom had been diagnosed with melanoma? If melanoma had been detected, the pathologist would have then been called upon to determine what stage the disease is at. Pathological staging tells the surgeon how aggressive the melanoma might be, and as such, directs further treatment. Tom's surgeon would likely remove more tissue from the area surrounding the mole for analysis. In the age of personalized medicine, pathologists are called upon to determine if a drug will work on a patient's cancer. These new drugs work by blocking specific genetic changes in a cancer called mutations. In the case of advanced melanoma, pathologists would use DNA sequencing to find such changes. These new treatments involve extensive laboratory testing to ensure no harm occurs to patients. Tom's story is just one example of how pathologists provide critical diagnoses and information that help drive your medical care. So now you know a little more about the role of a pathologist. To learn more about pathology and to meet some of Canada's leading pathologists, visit MyPathologist.ca.